Good afternoon. Happy Friday to y'all. This is Houston's dancing psychiatrist, Dr. Barry Gritz. Going to give a little talk on serotonin, norepinephrine, dopamine, and glutamate, 4 neurotransmitters that we think are involved in the biology of depression. Let's go over those a little bit. Serotonin. When I think of imbalances in serotonin, I think of symptoms of depression, plus anxiety, worry, anger, irritability, obsessionality. So that means a patient may be more sad, more irritable, more easily anxious, or thinking and ruminating and worrying a lot. Norepinephrine is a brain chemical involved in the symptoms of depression, but it's also involved in symptoms of lethargy and alertness. Remember that norepinephrine is also involved in modulation of pain, so what we can do is if you have a patient with pain problems and depression, sometimes a drug that increases norepinephrine can be useful. Then we have dopamine. Dopamine is a very important chemical involved in symptoms of depression, plus drive, energy, motivation, joy, pleasure, desire. So we think about that a lot. A lot of times patients will say, hey, since you put me on the serotonin agent, I'm not sad, I'm not irritable, but I'm emotionally flat, cognitively flat. Sexual side effects very common with serotonin drugs. So these are reasons to have a drug that increases dopamine. So we can either increase dopamine by dopamine enhancing antidepressants. We can also increase dopamine by adding some of the agents that we use that are augmenters of antidepressants. There are multiple drugs out there that augment dopamine that we use called SGAs, called second generation antipsychotics, but that's really a misnomer. We really aren't using them for psychosis. We're using them for depression augmentation. And I'm going to talk with you all about those drugs at a later date. But right now I'm talking about serotonin, norepinephrine, dopamine. And remember again that the depression augmenters can also improve dopamine and to some degree serotonin. So some of the depression augmenters, which I'll talk about at another time, can increase serotonin and or dopamine as well as other receptors. And then a newer antidepressant that actually acts as a glutamate antagonist. A glutamate antagonist similar to ketamine. There is an oral drug out that I'll talk with you all about someday that works on that. So these are all what I call structure-function relationships. In other words, a patient comes to my office and has complaints of depression. I try to look, do I think they need serotonin? Do they need norepinephrine? Do they need dopamine? Or they do need a combination thereof? Those are the kind of things I look for in an evaluation of a depressed patient. We have lots of choices at our disposal. Over the course of our time together here on YouTube, I will talk with you all more about the different antidepressants and the pros and cons of each, because each drug brings pros and cons to the table. But for that, I'm going to say goodbye to y'all now. I'm going to teach my class at 5:45 at LA Fitness at 155 Eldridge Parkway. Please come and join us. Come dance. You know, as a health and wellness physician, I talk about not only taking appropriate medication, but I talk about doing psychotherapy. I talk about mindfulness and mindful meditation. I talk about your diet and anti-inflammatory diet. And I definitely talk about exercise, both a combination of weight training and aerobic exercise. A healthy body starts with aerobic exercise. With that being said, your dancing psychiatrist, that's Houston's dancing psychiatrist, coming to you from Black Rock Cafe here in Houston on the west side of town, wishing y'all an amazing weekend.